Just make any adjustments on the machine to be able to use the tender bus?
I was informed by Katarina that the device, which is in Nigeria currently, this is a 30 hertz machine. So this machine is not theta burst capable.
I see. Okay.
But there is a possibility of upgrading the machine.
Right.
So I think to start, you will start with the RTMS, which is exactly as effective, but the only difference is the time.
Just the time it takes.
Exactly. Yeah. And if you are satisfied, and if you maybe in a couple of months when the customers, your clients are running the system, and they see positive results, and they say, okay, hey, this is a real alternative for us in order to treat our patients, then we can see. Okay,
they can upgrade to.
Yes, and if you, for example, if they find out, okay, our machine is loaded with patients from morning to evening, then it would make sense to make an upgrade. But if you have maybe only a couple of patients a day, there is no necessity to make an upgrade. Okay.
Is the theta burst, is it strictly 50 hertz, or can you
50
change
hertz?
it?
No, 50 hertz. That's a setup. This is a standard in the whole industry.
So it depends on the individual as well, because the motor. Sorry.
No. You have always used the 50 hertz because the researcher who did the studies, they only use 50 hertz, and they have shown that there's so many effectiveness, and so all manufacturers have to change the stimulators that they can also use the 50 hertz.
Okay.
So it depends on the individual, because some individuals, sometimes 50 hertz might be too much. Do you think? Or
No.
It's okay.
You only can adjust the intensity sometimes to gewöhnen,
to get the patient used.
Yeah, to get the patient used, and then you can level it up to the intensity you measured at the beginning. That is the only thing you can adjust, not the hertz.
Yeah. Just to complete the section. You can also create protocols, or they are already implemented, but you can use ramp trains. This is for the patient. This is a new feeling. Okay, when you have a coil placed at your head and the coil makes sounds and you feel also something, you will later feel it by yourself. Yeah. So to make the life of the patient a little bit more comfortable, you can have these ramp protocols, which increase and decrease the intensity, and but the only reason for these ramps is the comfort of the patient. So it's not it has nothing to do with the treatment or so. So the only reason of using ramps is comfortness of the patient.
So do you recommend that all patients, for the first session, do they start with the ramp trains first for comfortability? Or?
Well, there are obviously different approaches, and we will have this later hands-on. Katarina, for example, she has the approach to start when you have, let's say, you have sessions. Let's say you have 50 sessions. Yeah. So 50 sessions times 30 minutes, or 50 sessions times 3 minutes. Then Katarina would start, and you have a threshold of 50. Then Katarina would recommend to start maybe the first session with 30, and then go up 35, 40, 45, and so forth, till that the patient gets used to the feeling. And the adaptation is very, very fast. So once the patient knows what he's experienced, you can increase the intensity, and the most of the patients they have no problem with the increase of the intensity. And so after 3-4 sessions, you are at the level of the treatment. Of course, you have to add these sessions, so you cannot count these sessions for the treatment. So if you have 2 or 3 sessions that in order that the patient get used to the feeling, you have then the first session of the treatment protocol. You cannot add these 3 sessions to the treatment protocol. So if you have 50 sessions, then you have 3 sessions to that the patient get used to it. So in total you have 53 sessions then. Yeah. So this is the way Katharina does it. But there are I think there are some individual ways to do it. Yeah. And it at the end it depends always on the patient and on the person who runs the system. Mm-hmm. And so there is not a common a strict rule. Yeah? At the end of the day, you have to convince the patient that he wants to have the treatment and that he has a positive feeling in regarding of the treatment. Because this is also important that the environment and during the treatment is a positive one. And when I would recommend when you are in Nigeria, let the people feel it itself. Yeah? And some people, maybe you can start directly with the treatment level, for example 50. And some people, they say, oh, this is loud and so on. Yeah? And then with this patient, you maybe start with 35. Yeah? And give him 2-3 days time to adjust, and then run the treatment therapy with 50. Right. Yeah. That's what I would suggest.
So when you're treating the patient is interactive. The patient can actually give you some feedback.
Yes, and you should ask the patient, do you feel comfortable? Yeah. Mm-hmm. So because it's you will find out later. It's a strange feeling. Mm-hmm. Yeah. And but you get used to it quite fast. Right. But especially in the first time or the second time. Mm-hmm. Yeah. Yeah,
that's very important.
Okay. Yeah. So this is just little technical information. So in the old days, you have mainly monophasic pulses. Nowadays, most of the system produced biphasic pulses. This is the standard. This is the gold standard. Just for your information. Okay. And this system we show you here, and the system in Nigeria runs with biphasic pulses. Yeah, I think that's enough for this.
Sorry, I don't understand the other part. Does that mean? I don't understand this a little bit.
This is we are talking about the electromagnetic field. So this is really a technical thing. Okay. Something for the nerdy guys. Okay. Yeah. Okay.
So you don't have to know it.
Okay.
And same with this. Okay, maybe it's a little more relevant for the use of the system. So you have a posterior and anterior positioning of the coil, right. Because the field, the electromagnetic field, you have here inside a laying aid, okay, and this is copper. Inside there is a laying aid of copper, and this generates the electromagnetic field. Here at this spot, this is the treatment spot. Here is the point where 2.5 centimeters in this direction. There is the spot where the area which you want to treat gets the impulse, the pulse. And for example, here you have the coil. Here is the nose. Here are the ears, and here is the coil. So you come from the back of the head. And this is posterior. If I would switch the coil like this, it would be anterior.
Right.
This has an effect because the electric magnetic field is in that direction, and if you put it the other way, so the electric magnetic field is in the other direction. For you just to remember, coil positioning, we will have later a very detailed part on this, and but it makes a difference if you put it that way or that way.
Right.
Okay, just to know. All right.
What is the
Yeah.
difference? What like?
Because the magnetic field is now in this direction, and if you put it the other way around, it's in the other direction. So
Okay.
and this has an effect on the treatment.
Okay.
Okay, what peripulses? I think we can as we spoken about inhibition, so suppression, and facilitation. Yeah, it's just the display of the pulse, which actually, if recorded, would look like this. Okay. Yeah. Okay. We spoke about RTMS. So this is, for example, here a stimulation frequency, 1 Hertz, 1 pulse per second. So this length here is now 10 seconds, and you have 10 pulses, and this would be stimulating or suppression.
Pardon?
Well, this protocol with this frequency, what would the outcome be of a 1 Hertz protocol? Would it stimulate or would it suppress the area?
Suppress?
Exactly. Yeah.
Okay.
Exactly. And here you have a 5 Hertz protocol, which means 50 pulses in 10 seconds, and such a protocol would stimulate, exactly. So it's now we're getting a little bit used to the terms and get a feeling about what's going on. I think this ISI, this is more research relevant. We can just forget about this right now.
Question.
Yeah, sure.
The slower the hertz per second, does that mean like a? Sorry, I don't know how to ask the question.
Yeah.
Like the number of hertz you have like per 10 seconds, does that differ?
No. It's just here now. Just an example to have. We decided here in this to give as an example 10 seconds. we could have made this with 2 seconds or with 5 seconds. It doesn't matter. Just to see, just visually that you see the difference. Okay. Here I have 10 seconds. Every second 1 pulse, and here every second 1, 2, 3, 4, 5 pulses. And this is just a drawing that you see the difference, a visible understanding tool to say it that way.
So from 1 to 5 hertz would suppress, and from 5 hertz.
No. Actually, I would say 1 Hertz suppress, and from 5 Hertz plus stimulation. Stimulates. Yeah.
So from like 1 to 4 hertz would.
Yeah, actually, you would use 1 Hertz.
Just 1.
Yeah, just 1 Hertz
Okay.
for suppression, for suppression, and 5 plus Hertz for stimulation. Yeah. Okay. Great. Then. Okay. Okay. So this is now quite familiar already for us. Here you have these, in this case, 10 Hertz.
Sorry, I have one more question.
Yeah, sure.
Is the 1 hertz suppression, is that just for the RTMS or for all of it?
It is general.
Oh, okay.
It is a general marker when you have 1 Hertz and you make a treatment with 1 Hertz on a specific region of the brain. This will suppress this region. Yeah.
So for all protocols.
It is then a 1 Hertz protocol. So, for example, this protocol here would be called, no, sorry, let me go back, this protocol. This protocol would have the name 1 Hertz suppression protocol, for example.
Oh.
So you have a list of protocols, and if you want to have this 1 Hertz protocol, then you would select this protocol and then make a suppression treatment with that protocol. But it's there are a list of protocols for stimulation and for suppression, and I think for suppression there is only one protocol, yeah, the 1
It's
Hertz.
called, I think it's
Yeah.
called 1 Hertz or tinnitus
Yeah.
protocol. I don't know
Okay.
exactly.
Okay, but we will dive into this later. But for a brief understanding, 1 Hertz for suppression, 5 plus Hertz for stimulation.
Stimulation.
Yeah, and you don't have to create these protocols, so you have just to select them. Yeah?
Okay.
Okay. All right. So we have this, and now we come to the trains. We start here with, in this case, 10 Hertz protocol, but you see it's a rhythmic protocol, meaning you have now 10 pulses in 1 second. Okay, so 1 second, 10 pulses. And here you put these 10 pulses times 2. So you have 2 seconds with 10 pulses, meaning 20 pulses within these 2 seconds. Then you have this pause of 8 seconds, and then you rerun 2 seconds with 10 Hertz, meaning 20 pulses within 2 seconds. And after that, of course, 8 seconds rest or no stimulation, and so forth.
And you can select this
Yes.
protocol on the machine.
Exactly. Again, something like this is edited. This protocol, you select this protocol, and when you start it, then the machine will do it for 30 something seconds,
Yes.
30 something minutes. Yeah?
If you choose the protocol and you start it, then you should know that you hear pulses, and after maybe 20 pulses there's a pause and nothing will happen.
Okay.
And after that it will start again.
For about like 30 minutes?
Yes, maybe.
Something like
Maybe
Look-
what the
look here.
protocol, how long the protocol is.
You can
Uh,
measure. So,
Exactly. So here, this would be really an example for a depression protocol. You have 10 Hertz. You get all these slides. You get, but it's very good to make also some notes. But you will get all these slides also in the digital format. Yeah. You have a 10 Hertz, 2 seconds on, 8 seconds off. And then again 2 seconds on, 8 seconds off. And then you could also put this one into that black block, we call it train. So these 2 seconds of stimulation, meaning 20 pulses, we call this a train. Okay, so you have this 2 second train, then you have 8 seconds off, and then you have another train. And now you can put this on the timeline, meaning okay, you have 100 trains times 20 pulses, meaning 2,000 pulses. So
per
this
session.
no, sorry.
Per session.
Exactly. That is then one depression session,
Okay.
one treatment session.
Yeah.
Yeah. I think this is really we're getting very fast through it, and these are the most important things. In order to run the system. Okay, so we have the single pulse. We forgot about the pair pulse because this is more for research.
Also, you
have,
don't actually use it like practically.
sorry?
Do you use a pen?
No, not in a clinical environment. In a research environment, that could this is sometimes an issue. Then you have we have spoken about the RTMS, the repetitive TMS pulses. We have now learned the trains, and now last thing is a theta burst, which is simply you have even more pulses per second, in that like 50 pulses, yeah? And you then can shorten the length of the treatment. Yeah.
Sorry, you never really explained the single pulse one. Like what exactly
Single
it does?
pulse is just click, one pulse.
Yeah, what is it like? Do you use it in treatment sessions as well?
You use the single pulse to detect the motor
Oh,
cortex.
okay, yes.
Okay, but during the treatment, no.
Okay.
No, but the single pulse is the so from the single pulse everything starts. Having 10 single pulses in 1 second is then a 10 hertz, 1 second. So the single pulse is just one. Okay. Okay. Yeah, maybe we should. No, we will leave it there. Okay. This is just, I think, also very helpful information to have a little better understanding. Just for your information, there are round coils and there are butterfly coils. And this is what I meant with the laying 8. So inside there is a copper in that way. So here in the center you have the maximum depth of the treatment, which is like 2.5 centimeters plus minus, and it goes straight. So here you have more like a volcano, and here you have more like a finger pointer, yeah. And here in the center you have this 2.5 centimeter depth of penetration. And there is the area in the brain which we want to stimulate in order to have these positive results on the depression.
So,
yeah.
do you have the first one there, or is the second one that is used in Nigeria?
This is the standard to do it.
Okay,
This is just for you to have a little background information. But this is the golden standard for depression treatment. Is the double coil, the laying 8.
And for stroke treatments as well, or do you use the stroke treatments for?
Sorry.
You said for depression you use the double
Yeah.
one. Would that be for like depression, stroke?
Yeah.
Victims and
Yeah.
just the
For everything we have spoken so far, it's always that coil.
Okay.
Yeah. Okay. Well, I spoke, here you see it, okay, 2.5 centimeters, and you can see here also the center, so you get a little bit understanding about the field positioning and about the penetration rate. Huh? That's I think that's all you have to know in order to have a understanding what's going on.
And this will be seen practically as well, isn't it? This bit you would.
Yeah. We will do all this. Obviously, you can't see it practically. that the energy is the electromagnetic energy that this reaches 2.5 centimeters within the brain. We cannot see, but it's proved.
Okay.
Okay. Well, we spoke already about this. So 1 to 3 Tesla. And